The health care bill now a foregone conclusion, but what was lost in the shuffle was all that talk about tort reform, medical liability reform. Over $650 billion a year are spent on defensive medicine. That's 26% of all health care spending. Our next guest says Republicans have a plan to fix it.
And he is a doctor, and he knows. Now he's a Republican congressman, an orthopedic surgeon, and now Tom Price joins us right here in New York. Congressman, first off, I know you were upset about this. We've talked to you a number of times.
Yes.
But having said that, what chance do you have to get tort reform off the mat? Because the Democrats don't want it.
Well, I think the American people were upset because they know that this bill didn't address either the costs or the control of health care. Who's going to make these decisions? And in the area of defensive medicine, nothing really was done in the matter of tort reform or lawsuit abuse reform from the bill standpoint. And a quarter of all health care dollars are spent on the practice of defensive medicine. Now, there are positive ways to solve this, and that's what irritates the American people so much, because they know that we can solve this in a wonderful way, and it wasn't done in the bill.
You know, the interesting thing is I remember that big summit when the president called Republicans and Democrats together and was listening to their ideas, and tort reform came up.
Yes.
But it somehow didn't make its way into the final bill.
Well, Howard Dean, as you'll recall, was the most honest in all of this when he said, we can't deal with tort reform because we don't want to take on the trial lawyers. But the people across this land know that the issue of lawsuit abuse reform is absolutely imperative if you're going to do anything as it relates to health care. And certainly the doctors do. As a physician, I know that there are doctors who are stifled and oppressed by what's going on right now in the health care industry.
They just order a bunch of tests because they have to.
And they have to.
But the thing is also that the AMA came out and they put on their lab coats and they said, we support the president. But it didn't represent everyone. And doctors are now speaking out. But where were they before?
Well, they've been, a lot of them across this land have been talking loudly. The actively practicing physician, the doctor in the field, the guy and the gal out there taking care of patients across this land are very upset about this bill because they know it will remove their ability to make independent medical decisions with their patients. And that's wrong. That's not what they do.
Okay, so you introduced this bill, the Republicans do, before health care reform is passed. So what are the chances that we're going to see any tort reform?
Well, not under this speaker, I'm afraid. But what we believe is that it's important to provide the contrast to the leadership that's going on right now. People are upset across this land. They know this bill wasn't the right thing to do. We've got the right positive solutions, and we believe the American people will support it.
Stay out of trouble in New York. A lot of temptation. Congressman Tom Price, thanks so much for coming in. Great to see you again, Doctor.
Thank you so much.